Hello, my name is Mallory Meyer, and today I will be informing my audience about what occupational therapy is. According to the National Board of Occupational Therapy, it is a healthcare profession that focuses on helping people be able to participate in meaningful activities they need and want to do. The typical OT client is one who has experienced a change in their ability to fully participate in chosen activities. Occupational therapy is unique in that it uses a holistic approach to not only look at the reasons a client can participate in activities, but also the client's roles and environment. This includes wellness promotion, rehabilitation, and habilitation. OT profession assists the client to regain function or adapt to changes by assessing and addressing the physical, cognitive, psychosocial, sensory, and environmental aspects of recovery. A typical OT client is one who has had a stroke, people with autism or any other developmental disorder, people who are recovering from surgeries, most often hip surgery or shoulder replacement, people who suffer from depression and anxiety, or the elderly. Some history behind occupational therapy. It had its roots in the late 1800s when art and craft therapists began to work in hospitals using a hand-on approach to engage patients in mental and physical illnesses. In 1917, the OT was primarily used in mental health institutions. They found that patients who were engaged in occupational therapy and were included in everyday activities like crafts, farming, cleaning, they seemed to be more healthy than other patients. These findings led to doctors to encourage patients to engage in such activities regardless of their class or social status. In 1917, after this was found, a group of professionals formed the American Occupational Therapy Association, also known as the AOTA. In the early days of the organization, much of the focus of occupational therapy was on reconstruction age or rehabilitating soldiers who had been injured during World War I. Most people do not know what occupational therapy is. They associate it with the profession of someone trying to find a job for someone else, since the profession has occupational therapy in it. In a way, yes, we're helping someone find ways to adapt themselves to be able to perform their job in life, but we use different approaches than what a person would define a job. In my speech, I'll be explaining these aspects to my audience. When we hear the word occupation, we think of a job. Most people, when they ask what is your occupation, they think of what they do on a daily basis and what is meaningful to them and to occupy their time. In occupational therapy, occupation includes play, leisure activities, self-care activities like bathing and dressing, and home management, to name a few. In children, the main occupation is play. Occupational therapists really focus on play being the most important occupation for children, so they can develop and get that social interaction with others. With adolescents, it's usually finding a job, completing school. With adults, it is usually child rearing, marriage, raising a family, making a career, and looking forward to their retirement and into the future. For the geriatrics or elderly population, usually includes things like getting dressed, crocheting, playing bingo, interacting with others in their residence hall or if they're in a facility, things like that. The next thing I'll be explaining is what ADLs are. ADLs are activities of daily living. This is essential that people perform these tasks on a regular basis. These ADLs are what help a person be able to survive and help their well-being. According to the Occupational Therapy Practice Framework, it defines ADLs as activities that are oriented toward taking care of your own body. There are 9 areas in ADLs. This includes bathing, dressing, toileting, eating and swallowing, feeding, functional mobility, personal device care, personal hygiene and grooming, sexual activity. Another term used is basic ADLs, known as BADLs. Those are typically dressing, feeding, bathing and showering, personal hygiene, and toileting. The next thing I'll be talking about is IADLs. This is instrumental activities of daily living. These refer to activities that support daily life and are oriented toward interacting with your environment. IADLs are usually more complex than ADLs. They are important components of home and community life, but can easily be delegated by a person. So this includes care of others, care of pets, child rearing, functional management, driving in the community, money management, home establishment and management, and many others. The next thing I will be talking about in my speech is what a typical therapy session looks like. Usually a typical therapy session is anywhere from 30 to 75 minutes depending on the level of function of the patient. During the therapy session, the OT or OTA will look at the person's plan of care and see what goals they have. So for example, a person who has had a stroke, some activities we would do with them would be to continue to strengthen their upper extremity, place cotton balls on the affected side and have them reach over and pick them off to draw attention to that affected side, getting undressed and redressed, and using adaptive equipment like a reacher, a shoehorn to help put shoes on, and a sock aid to help put socks on. In conclusion, OT is a very important type of therapy for a person to receive after an injury. I have seen firsthand how OT can help a person get back to their prior level of function being in my full-time clinicals currently. I find OT to be such a rewarding profession to be in. As I am currently in the OTA program at Washburn, I plan to graduate in May. I cannot wait to start my career in this field just because of the fact that it is so rewarding. I have been touched by so many people already in the field, and I can't wait to continue to experience this. Thank you for watching my speech.